So good afternoon, everyone. We have a few people trickling in, so I'm just going to give everyone a few minutes and then we will get started. Okay, so good afternoon, everyone. This webinar will be recorded, so everyone is aware. Your microphone and camera will be turned off for the duration of the webinar, and to ensure accessibility, live captions can be enabled from the control panel. So my name is Carlene Stobie, and I'm a knowledge translation specialist with the National Collaborating Center for Methods and Tools, and I will be your facilitator today, and Alana Miller will be our support. We have a wonderful presentation for you today on the insights from the 2023 Knowledge Translation Student Award recipients, which will be presented by Jordan Henry, Karen Wong, and Leah Taylor. We are here for the winners of today's National Collaborating Center for Public Health Knowledge Translation Student Awards. We'll be getting a firsthand look at their crucial work in bridging the gap between research and practice. These students are leading innovative knowledge translation strategies, and this session highlights their academic excellence and features unique and transferable strategies to address today's public health priorities. So before we begin, I have our land acknowledgement and a few housekeeping comments. The NCCMT is hosted at McMaster University in Hamilton, Ontario, which is located on the traditional territories of the Mississauga and Haudenosaunee Nation and within the lands protected by Dish with One Spoon, Wampum Agreement. So a few housekeeping comments for everyone today. We recommend using a wired internet connection for the webinar. For best results, if possible, use the latest version of Google Chrome or Firefox internet browsers. If you have any technical difficulties, please send a private message to Alana Miller, NCCMT, and we'll be able to respond to those requests. If you have any questions for the presenters throughout the webinar, please send them to the Q&A, and we'll make sure to get to those at the end of the webinar. There will be a few polling questions today in the webinar. When they're open, they will pop up over the slide. Please note there might be a slight delay in the polling questions popping up. So once you see them, hit your response and press submit. The slides and recording will be available after today's webinar in about 2 weeks' time. The recording will be posted on our YouTube account and the slides will be posted on our SlideShare account. We will also send out tweets when they are posted, so keep an eye out for our Twitter at NCCMT. So we have our first polling question for everyone today. You'll see it pop up shortly on your slide. These questions ask, how many people are joining today's session with you? Have you ever visited the National Collaborating Center's website or used their resources? And if you stated yes, how many times have you been to our website? So I'll give everyone a few minutes to answer those questions. Okay, so the National Collaborating Center for Methods and Tools is one of 6 national collaborating centers across Canada. We are hosted at McMaster University in Hamilton, Ontario, and our goal is to support public health professionals and organizations integrate evidence-informed decision-making into their work. The National Collaborating Centers are funded by the Public Health Agency of Canada. We each focus on different public health priority topics. From the West, there is the National Collaborating Center for Indigenous Health in Prince George, British Columbia, the National Collaborating Center for Environmental Health in Vancouver, British Columbia, the National Collaborating Center for Infectious Disease in Winnipeg, Manitoba, the National Collaborating Center for Health Public Policy in Montreal, Quebec, and the National Collaborating Center for Determinants of Health in Antigonish, Nova Scotia. At the NCCMT, we have many products and services to support public health professionals in engaging in evidence-informed decision-making. This includes a registry of methods and tools with over 270 methods and tools, online learning opportunities, including our 13 online learning modules, workshops, Public Health Plus, which is a repository of public health research, video series, including our Understanding Research Evidence videos, which go through concepts important to research in short and easy to understand videos, and also networking and outreach activities. So for our Knowledge Translation Graduate Student Awards, knowledge translation is a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of people in Canada, provide more effective health services and products, and to strengthen the healthcare system. The purpose of the Knowledge Translation Student Awards is to recognize the work of graduate students for knowledge translation and public health in Canada. Submitted projects were evaluated on their relevance to knowledge translation and public health, creativity and innovation, scholarliness, and potential impact. So we had lots of great submissions this year, but without further ado, I present to you our winners. So our winners today are Jordan Henry, Leah Taylor, and Karen Wong. So I'm going to introduce our first presenter today, and then I will hand it over to her. So our first presenter today is Jordan Henry. Jordan Henry, she, her, is a part of the She Shims settler and a member of the Lax Kw'alaam band with 9 years of experience contributing to reconciliation and anti-racism in health and educational system. As a PhD student at the University of British Columbia, Jordan studies Indigenous public health and the system that drives health disparities. She intends to better understand the prevalence and factors associated with experiences of racism to inform policy and service provision. Jordan works at the Office of Provincial Health Officer as a research assistant for the Unlearning and Undoing White Supremacy Project. Taking her learnings from her various lived and academic experiences, Jordan funded the SPPH Unlearning Club. She uses strong leadership to embed anti-racism and Indigenous ways of knowing into multiple levels of governance at UBC, doing so through serving on committees at the School of Population and Public Health and being a graduate student representative to the UBC Vancouver Senate. So I will stop sharing my screen now and hand it over to Jordan when she's ready.
Thanks so much, Carlene. I'll just quickly share my screen. There we go. You can see that fine? Perfect. Okay, thank you, everyone. I'm really excited to share my presentation with you all. I'll just briefly introduce myself. Like Carlene said, my name is Jordan Henry. I'm Tsimshian from my mother's side and a member of the Lax Kw'alaam's band, which is located in northern coast of British Columbia. And then I have British and Irish ancestry from my father's side. So today I'm going to be talking to you about a project that was within the Unlearning and Undoing Systemic White Supremacy Project, and it's put on at the Office of the Provincial Health Officer. So my project is titled Instructions Have Been Provided, Actioning Foundational Commitments to Indigenous Peoples in the BC Office of the Provincial Health Officer. I want to begin by acknowledging the territories that I'm calling in from. So I am here on the unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh peoples. I also want to acknowledge the elders, the mentors, and the teachers who have taught us lessons that we bring forward in this work, and all the people within BC where we work that have died as a result of systemic and interpersonal racism over the past 150 years. It is also our protocol in our work to recognize the inherent rights of First Nations that stretch over every inch of this province. Inherent rights are rooted in connection to land and waters and have never been ceded or surrendered, and they're upheld in international, national, and provincial law. And this serves as a reminder to carry out all of our work with an Indigenous rights-based lens, whether it's Indigenous focused work or not. So for those of you who are unfamiliar with the BC Office of the Provincial Health Officer, this division is within the Ministry of Health and in BC and is responsible for monitoring the health of the population through data and conversations with community, advising ministers and public health officials, and issuing recommendations related to public health issues. Okay, so on this slide, you'll see a non-exhaustive list of foundational commitments that have been made to Indigenous people. Indigenous voices have rung loud and clear with foundational directions, how we need to reset relationships and move towards a desired future of reconciliation. So our government has made commitments to uphold things like the truth and reconciliation calls to action, the murdered or missing Indigenous women and girls calls for justice. With those two reports alone, we received 335 recommendations, and many of which are relevant to public health. In BC specifically, we have many other foundational directions, things like the BC Declaration Act, that came from the United Nations Declaration on the Rights of Indigenous People. We have two more, which are closely tied to our mandate in our office, which is the Grandmother's Perspective and In Plain Sight, which focuses specifically on racism in BC healthcare. And so what we realized is that a significant amount of instructions have been provided, and it is now our responsibility as public health professionals to action them. So what we did is we developed a mixed method tool that focuses on measuring and understanding action that has been taken towards the foundational commitments to Indigenous peoples. So first, participants are asked to rank their level of engagement with each set of instructions. So you'll see here UNDRIP, BC JIPA, the action plan. I recognize some of the BC specific ones might not be familiar for those from across Canada. Murdered and missing Indigenous women calls for justice, In Plain Sight. And they were asked to rank them as not aware, heard of it, read it, engaged with it, or taken action. Second, they were asked to reflect on why they chose this ranking and what they mean if they put engaged with or taken action. And third, they were asked to identify barriers or facilitators to action, as well as potential supports required to uphold the foundational commitments moving forward. So for this presentation, we're going to focus on the quantitative results found in section 1 of the self-assessment under the rank. So it was very clear from putting this self-assessment out that there was extreme variable knowledge within our office. So the darker color is more engagement. And you'll see with the United Nations Declaration, the blue, that only 2 people in our office had ever taken action with this report. And that is a very foundational report for upholding rights of Indigenous peoples. There was many people who were not aware of certain things like Truth and Reconciliation, which has been out since 2015. So what we want to do is grow the darkest piece of that pie. So how did we respond? We decided to take an integrated knowledge translation approach to our research. We created the Foundational Commitments to Indigenous People series, and it's a workshop series that aimed to educate our staff members on instructions that have been provided by Indigenous people. So each foundational commitment series session covered a different report, act, or inquiry that provides clear direction to address Indigenous specific racism. These sessions were held once a month. You can see the dates that we used, and for a total of 4 sessions. So session 1 centered on UNDRIP, and also our BC specific version of UNDRIP. Session 2 focused on TRC and MMIWG, which are the 2 national reports. Session 3 focused on our BC specific report, which is In Plain Sight, Indigenous specific racism and discrimination in BC healthcare, which also has many recommendations in it. And then session 4 focused on integrating the first 3 session teachings and what it means to be accountable to these obligations and how to demonstrate trustworthiness through our actions. So all of these sessions were mandated for the entire office by our provincial health officer, Dr. Bonnie Henry. and all team members were required to complete homework before attending the sessions. And that was reading the reports, acts, or inquiries, and identifying key instructions related to their own work. So for the homework, we provided a quick tip, which was just the instructions. So for example, the truth and reconciliation, it would be just the calls to action, or we provided a deep dive option, which was reading the full report. And so that's so participants could triage based on their workload that month. So they could choose either one every month. So the prep work required roughly 1 to 2 hours each month. And then the workshop was 2 hours for a total of 4 hours of required work per month. So I have some examples of what homework questions were that they were asked to respond to before coming to the session and just reflect upon. So for example, for session 1, after they read the United Nations Declaration on the Rights of Indigenous People, they were asked to identify at least one action they could do or currently do to uphold UNDRIP Article 24. For session 2 and 3, they were asked to choose specific instructions from the report so that they feel they could uphold in their work. And then session 4 was a deep dive into how to integrate all those teachings. And it wasn't exactly a step-by-step guide that we provided for them. They helped us create this guide. They reflected on ways they could support the integration using their different spheres of influence. So we did another self-assessment survey after the series, and we found essentially that the series worked. The post-foundational commitment survey really showed an improvement of people's understanding of the foundational commitments. So you can see up on the left for UNDRIP, no one was no longer aware of it. Same with the BC DRIPA. Significant amount of people for in plain sight on the bottom right had moved to taken action and engaged with. Oh, and I should say the darker color is the newest data. We still have a long ways to go, but having everyone at the same level and having the same information is a significant start. So finally, what we've learned is that instructions of how to uphold these rights have been given, and it is now our turn to implement them. So as settler colonial institutions, we have obligations to uphold rights and rectify harms and advance reconciliation. Through this series, we assess our team's familiarity of the foundational commitments and improve the variable knowledge. And now this training will actually be mandated for all new staff. So it'll be important who anyone comes to our office has this baseline level and has a responsibility to breathe life these foundational commitments and do all of the work they're doing. So that's it. Thank you so much for listening. I'm really excited about this knowledge translation piece, and we're going to be putting out a paper soon that shares a lot of the tools that we used. And potentially more tools will be published in the future, but I look forward to any questions.
Thanks so much, Jordan. That was such a really great presentation. It's great to see the changes on the graphs. So I'm going to introduce our next presenter. So our next presenter will be Leah Taylor. Leah is a CIHR Canada Graduate Scholar in the combined PhD Masters of Science and Occupational Therapy program at Western University. Leah's current research focuses on practical applications of the Canadian 24-hour movement guideline as a tool in occupational therapy for young children with developmental disabilities and evaluating community playgrounds for inclusion. Her experience in the field of inclusive physical activity includes acting as a coach for her local Challenger baseball team, supporting exceptional athletes learning to row, and working as a recreation coordinator for the Department of National Defense. Leah is also a student representative on the board of directors for the North American Society for Pediatric Medicine. So I will once again stop sharing my screen, and Leah, you can take it away.
I'm unmuted now. So hopefully everybody can see that okay, and we're good to go. So maybe Jordan, is that working for you? Or Carlene? Good, perfect. Thank you so much. All right, so thanks so much for having me here today, and thanks for that introduction. As mentioned, my name is Leah Taylor, and I am a combined occupational therapy PhD candidate at Western University. So on behalf of my supervisor, Dr. Trish Tucker, and the Child Health and Physical Activity Lab, I'm going to be presenting on the Everyone Can Play tool. So physical activity is essential for supporting children's health, development, and overall well-being. I probably don't have to tell that to this group here today, but despite our efforts over the last 2 decades, physical activity levels of Canadian children are consistently low, and this is continuing to make this a public health priority. Our team at the Child Health and Physical Activity Lab conducted a systematic review of physical activity levels of young children, so under the age of 6 with disabilities. And we found that although physical activity levels varied widely by disability types, overall levels were very low. And this aligns with our recent research, which indicates that most Canadians aged 5 to 17 years old with disabilities do not meet the national daily physical activity guidelines. So when we think about physical activity, it's important to think about more than just the person and what's shaping that person's opportunities to be physically active. So children's environments shape their opportunities for physical activity engagement, and this makes environmental interventions an essential space to support physical activity levels. The Canadian Disability Participation Project recommends promoting inclusive physical activity as an opportunity in the sport and recreation sector as a positive first step to supporting the physical activity levels of children with disabilities. And research also indicates that the availability of adequate resources in the community is a facilitator for physical activity for children with disabilities. So we sought to address barriers to locate inclusive programming by drawing awareness to the inclusive physical activity opportunities in our city. Working with our local child and youth network, we created a virtual knowledge translation tool to amalgamate all the physical activity opportunities in our community, which were advertised as being available to children with disabilities. So this project was developed using the integrated knowledge translation approach, where academics, so our team, and the local decision makers at the Child and Youth Network, which is supported by the City of London, partnered to employ evidence-based research to improve our service delivery. So I'm sure that the group here today is very familiar with this model, but I just wanted to go over these points very briefly on how it played out in our research. So in terms of the intervention content, the Child and Youth Network identified the physical activity levels of children with disabilities as a priority in London, Ontario. And we identified that the promotion of inclusive physical activity opportunities were going to be a positive starting point. So the next point was the participants and roles. So the Western team, which I was a leader on, conducted the research with the CYN, or the Child and Youth Network, consulting on production and dissemination of the resource. So the intervention was created by the Western team, and the mode of delivery was that the tool was housed on the Child and Youth Network website as a virtual living resource. So I'll get into that a little bit more in a bit. The evaluation of the tool, so use and uptake is measured by assessing the relevant metrics and our user engagement by both the CYN and the Western team. All right, so we conducted an environmental scan of all of the services in our community to identify opportunities for participating in adaptive, para, inclusive, and anything that was advertised to children with disabilities, sports, camps, fitness programs in our city. And then we also used the results of a recently published scoping review that I led on evaluating playgrounds for inclusivity of children with disabilities. And we were able to identify parks in our community that had accessible features. So the subsequent resource was created in line with the recommendations for developing and disseminating physical activity information for families of children with disabilities, And this is provided by the Canadian Disability Participation Project. If you're looking at your screen, you can scan this QR code and you can access that resource if you're interested. And this specifically included considerations for language and definitions, providing clear, detailed information for the available programs, offering information about the benefits of engaging in physical activity, and sharing additional tools and resources to support inclusive physical activity participation beyond the resources in London alone. So here are some of the activities identified. I'm not going to cover all of them at length, but you can scan the QR code on your screen to see the Everyone Can Play tool. To date, our resource has over 1,600 active engagements since January. And you can also check out the interactive map, which provides the locations of parks that we identified as having accessible features. Each park has a description, and then the corresponding photos that are available through Google are tagged into the descriptions as well. So we intentionally made this tool a living resource, and I mentioned that a little bit earlier. And this was important for a big reason, which is that as we have ongoing updates to our community and as we see further community engagement and people using this tool, we can continue to make updates and maintaining the relevance for our users. Community organizations have actually already been in touch to take advantage of this feature, and we hope that as awareness grows, they continue to do so. And as well, we also have a poster available on our website. So this can be used by our community partners for virtual or physical dissemination. And in terms of ongoing promotion of the tool, we've been continuing to engage in knowledge translation activities, which has been a good source of support for those 1,600 engagements. So this has included stories on CBC Radio London Morning in Western News, and then the Western Health Sciences Department released a story as well. Background information, media coverage, and infographics are all available on our lab website, so they can be shared by community partners with their clients. The resource was also shared with 170 CYM partners, as I mentioned, and as well as their clients. So that was really positively accepted and heavily promoted. And we were also fortunate to present this project at a local research dissemination day, and the audience there included families, healthcare practitioners, and researchers from across the city. So that was that, and short and sweet for me, but I'd like to thank the National Collaborating Centers for recognizing our project with this award and providing me with the opportunity to share the resource with you today.
Thanks so much, Leah. It's so great to see all the engagement with your tool, and I'm excited to see how it continuously gets used. So now we have our final presenter today, Karen Wong, and I will introduce her. So Karen Lockye Wong is currently a second year PhD student at the University of British Columbia School of Social Work. Her research interests include aging and cultural, racial, immigration, and language diversity, the experience of people living with dementia, and aging and technology. She has conducted research on her interests and has published and presented widely, both academically and professionally. She is a recipient of the Social Sciences Humanities Research Council Doctoral Award and Age Well Michael F. Harcourt Policy Fellowship. Karen is also a registered social worker in British Columbia. She's been practicing in diverse settings related to older adults, such as community senior services centers, long-term care, geriatric acute care, and rehabilitation program. She's now practicing as a social worker with Providence Healthcare. She received different clinical practice awards, which acknowledge her excellence in practices, supporting older adults and their families and facilitating interdisciplinary team collaboration. Karen is a core member of the Seniors Committee of Practice and Anti-Racist and Actions Committee of the British Columbia Association of Social Workers. She's also a long-term volunteer for the Alzheimer's Society BC as a family support group facilitator and public educator. She was awarded the Inspiring Social Worker of the Year in British Columbia for 2021, which recognizes her advocacy work with people with dementia from diverse cultural and language communities. Karen is an experienced in knowledge translation, combining her knowledge, skills, and experience as a researcher and social work practitioner. She conducted knowledge translation projects on policy advocacy, enhancing clinical practices, and promoting cultural and language diversity. So Karen, I will stop sharing my screen and the floor is yours.
Thank you, Colleen. The slideshow. I hope everybody can see my screen. Yes, okay, thank you, Elena. So thank you. To begin with, I would like to give a land acknowledgement, and I'm in Vancouver. I would like to begin by acknowledging that the land on which I am in is the traditional, ancestral, and unceded territory of the Musqueam people. Okay. So, hello everyone. My name is Karen, and our topic today is how academic work implements public health knowledge translation strategies using a study on older adults' access to technology as an example. And I'm very grateful that this study received support from different partners, including HWell, Simon Fraser University, University of British Columbia, and also 411 Senior Center in downtown Vancouver. And I would also like to express my appreciation that this study has the opportunity to collaborate with senior members, service providers, university researchers, and other members in the community. And it is really my great honor and pleasure to collaborate with all of them. I would also like to send my very sincere thanks to the National Collaborating Center for Public Health for the award. It is a great encouragement for me and also my team to continue knowledge translation work. Thank you very much. So in the presentation today, I will talk about our study and also mention some conventional output. However, the main focus of today's presentation is about the use of knowledge translation strategies, how we mobilize the findings of this study in creative ways. So I would like to give some background about this study. So there is more health information resources and also services moving online and remotely, and access to technology is becoming a necessity for many older adults. With the opinions from our senior members in the community, we conducted a service enhancement study in British Columbia, Canada from March 2020 to February 2021. And we used qualitative research methods. We interviewed 28 stakeholders. Some of them are older adults who are volunteers, supporting other older adults. Some of them are older adult service providers, and some of them are policy developers. We also observed in service provision sections, and we conducted a thematic analysis following a mix of inductive and deductive approach. And this study have a couple of findings. I will highlight those which are most related to our knowledge translation work. And the first one is older adult access to technology requires technological equipment, the internet, knowledge, and also confidence using the technology. And we find that many older adults lack either one or more of these resources, and these four resources are interrelated. Another very key findings related to our knowledge translation work is that there are within group variations among older adults in access to these resources. Some groups experience more challenges than others in access to these resources. For example, those coming from immigrant communities, those who are more socially isolated, and those who are experiencing a low income. So our knowledge translation work, which I'm going to introduce today, is very much related to seniors who are in low income. And the following is a quote from an interview with one of our volunteer stakeholder. What she said is that a client wishes to join our online program, but his internet is unstable because he shares the internet with his neighbor as he cannot afford his own. For this study, we have some more conventional outputs. For example, we presented at academic conferences, and we also have conference proceedings. We also published peer review a journal article and also book chapter, as you can see on the right side of the screen. However, what I would like to particularly highlight today are some more creative outputs which are more accessible to the public and bring more practical social changes. So the first thing we do is public education. So we had a public workshop in collaboration with A12. We were also invited to share our findings at public forums and panels, and also through the media. We also published a report in more accessible language and distribute it throughout British Columbia and also Canada. And one of our team members, she was a journalist. She worked as a journalist, and she is still a journalist. She was a journalist before her retirement, but she is still doing journaling work after her retirement, helps to make the language of the findings more accessible to the public. And we also attract people coming from a diverse background through all these conferences, forums, media interviews. So we have older adults coming to us, also public health staff, managers all across Canada. And many of them reflected that the issue we are talking about is not only a Canada West issue limited in British Columbia, but also in other parts of Canada, which is a Canada-wide issue. And we also produce an infographic policy brief. And I would like to send very special thanks to UBC New Scholar Program for funding the creation of this policy brief. And it is an infographic policy brief in more accessible language to the public. And it was sent to different departments and organizations in British Columbia. And here I would like to also thank the A12 for the Michael Harcourt Policy Fellowship for supporting this work. And it is a really great encouragement for me to continue to do work related to tech-related policy. And The last knowledge translation strategy we apply for this study, which are based on the previous work we did, public education, and also the policy brief speaking to policymakers, is that we use the finding to support a national policy campaign. And the finding of this study have been adopted to support this national campaign to support older adults to access to more affordable internet. As I mentioned, one of the key findings from the study is that some older adults are not able to access to good quality internet because of the cost of it. And we talked to and wrote to policymakers, Canadian Radio, Television and Telecommunication Commission, and some big telecommunication company. And we successfully lobbied TELUS to extend their low-cost internet program for low-income older adults. And some of you, especially those of you living in British Columbia and also Alberta, may have heard of this program, the Internet for Good program. So older adults receiving a GIS can have more accessible and affordable internet. So they can have access to the internet by paying $10 per month. And currently, we understand that some of the older adults, despite they're in low income, however, they're not receiving a GIS. One example would be some older adults who are sponsored to come to Canada by their families because of the length of stay residence requirement of guaranteed income supplement. They are not eligible for it, and thus they are not eligible for this Internet for Good program. So that's why we are continuing our work and hoping that the program can be extended to older adults who are not receiving GIS, but also in low income. And also, as I mentioned, access to technology is a Canada-wide issue, and we hope that the Internet for Good program for older adults can be extended to the other provinces as well. So this is the end of my presentation, and I would really look forward for any questions and also comments. And this is my contact email, and look forward to hearing from you more. Again, I just want to express my very heartfelt thanks to the National Collaborating Center for Public Health for the award. Thank you so much. Thank you for listening.
Thank you, Karen. That was really great. And it sounds like you had some really successful knowledge translation strategies. So now we will move on to the question and answer portion of this. So if anyone has any questions, please put them in the Q&A. I see there's some here now, so I will go through them. So Samantha says, congrats on your work, Jordan. Has BC been in touch with other provinces to adopt your research and actions?
Yeah, thank you for that question. One of our principles for our work is to share it as far and wide as we can. But currently it's been limited to BC and our network here, and those who hear our presentation are interested in our tools, and we generally meet one-on-one and see how we can adapt it to the program or area you're working in. We don't really have that many partners outside of BC, but we would love to chat with you and see how we can implement it wherever you are. I'll put my email in the chat because I realized I didn't have it on the presentation. And yeah, feel free to send us an email if this is something you're interested in implementing, and love to work through that. Oh, I think it maybe just went to hosts and panelists. Oh, there we go. I'll put it to everyone.
Thanks, Jordan. A next question we have here from Florence. So thank you for sharing your work, Jordan. This is super interesting. How do you envision the training of new staff in the future, since they will probably not benefit from the momentum derived from participating in this process together with the whole team?
That's a really good question. So What we did is we recorded all of the presentations, and we're currently working on making essentially like a guidebook for new hires that have links to the presentation, have all the tools out there, like will be accessible to them. And then within our office, we have the Unlearn and Undoing project. So we're going to actually, I should have probably stated before, but currently it's a postdoc student, Dr. Kate Youngblood, who's running that project. But we have just been approved to have a full-time Unlearning and Undoing person. So the new hire will be asked to watch all those videos and then meet one-on-one with the UNU lead to have any further questions. But it is something we're hoping that the momentum, the conversations continue office wide, and that'll start within the smaller teams, so the epidemiology team, the reports team, and then at our monthly check-ins, we're hoping to continue by having different learning opportunities. That'll be shorter because our monthly meetings are only an hour in length and all the different teams need to discuss things. But yeah, we're going to see how that goes, but we might have to adapt based on what you were saying. If the new employees don't feel like they're getting the same training with the entire team, but just at least getting the baseline knowledge through the videos, I think is a really good start.
Thanks, Jordan. So if anyone has any more Q&As, please make sure to put that in the box. I have a question while we wait for that for Leah. Leah, have you received any feedback regarding the tool, or how do you plan to implement some of that feedback considering it's a living review?
Thanks so much for that. Yeah, I actually had the opportunity to meet with the recreation lead at the Thames Valley Children's Center. So TVCC is what they go by, but that's what it stands for. And they are responsible for the majority of rehab services for kids in our area. And so the two of us touched base, and they actually really appreciated the tool. Because often this is the type of thing that maybe goes out once a year, and then information is outdated, and it takes a full year to make everything get back up and get back posted up again. So their feedback for us was they had some more points to add as well. They had some additional programs. They have their finger on the pulse with things as as things change and adapt. So we were able to incorporate that feedback into the tool. And I think that's going to be a good partnership going forward as well, to just sort of maintain relevance, being that they work with a lot of their clients who would be the ones accessing this resource. So I'm not sure if I answered your question, but I hope that gives you some insight.
No, that was great. Thanks so much.
Okay.
Okay, I have a final question for Karen, actually. Karen, do you want to walk us through the process of lobbying with TELUS? I would imagine that was probably an interesting process for you.
Sure. So we begin by doing the study and trying to understand more about this area of challenge. So this study is based on the experience of many older adults themselves, like experience the challenging accessing to technology, and also those older adults who are doing support work, supporting other older adults. So we came up with this idea that we need to learn more about this area. So that's why we did this study. And some of our members suggest that we hope to bring some more practical changes, because we understand that although like education, raising awareness is important, but eventually we would still like to bring some policy changes. And that's why our members came up with the ideas. Perhaps we can do lobbying with different, not just TELUS actually, with different big telecommunication companies, and also, as I mentioned, the Canadian Telecommunication Board. and also with some of the policy makers as well. So that's why we try to turn the findings into a more accessible language, because we understand that our stakeholders, they may not be as familiar with the language of research as some of our team members are. And as I mentioned, like, we are very lucky that we have people coming from very diverse life and also professional background, which could help us to do so. And that's why we write to some of our members, we write to, and also we speak to different telecommunication companies, and we also collaborate. We understand that when we come together, we become a bigger, we bring bigger impact. So apart from our center, service centers, we also collaborate with the bigger team, like with other stakeholders who are interested in this area. So apart from older adults, some other population are also experience the challenge of the high cost and affordable cost of internet. So for example, people with disability. So that's why we collaborate with an organization called Alcon. We believe that when we come together, we become a bigger voice and stronger force. So that's how we lobbied. We have a stronger support at the back to lobby with the telecommunication company, with TELUS. And TELUS, they have I would say that they have the Internet for Good program, but it's not extended to the older adult population. And this study, it's very helpful for them to understand that indeed many older adults, they do have this challenge. And I'm so glad that the study and also the passion of our older adults experience the challenge, and also their allies, we all can come together to become the force, bigger force, to do the lobby work. And I think one more strategy I hope I highlight enough during the presentation is the be very aware of your disposition of your stakeholder and the language they use. So that's why I repeatedly emphasize it's so important the language is accessible enough, because like some big tele companies, they may not have the time to actually go through the whole 50 pages of report, or like some of the policy makers, they really do not have the time to talk. So that's why doing that knowledge translation work to make it more accessible, it's very, very important. And I hope I highlight this enough in the presentation. Yeah, thank you. Thank you. I hope this answered the question.
Thanks, Karen. Yeah, and I think you brought up a really good point on the importance of knowledge translation, the language you use, and making sure it's targeted to your specific audience. So before I close out this webinar, I'm going to give the chance to our presenters if there's any final comments, any final words. Now is your chance to do so. Otherwise, I will continue.
Well, I just want to mention for those of you who are who are interested to learn more about the digital divide in among the senior community, there is a webinar which we did for Age Well recently, and also earlier, I believe in 2021. If you're interested, please search Age Well Digital Divide with my name. You would be able to find that webinar. Mm-hmm.
Thanks so much. So to wrap up, if you're using EIDM in your practice, we want to hear about it. So feel free to email us at nccmt@mcmaster.ca. If you need any support for EIDM, please feel free to contact us at the same email address as well. And we typically respond within 24 hours. We have a final poll for everyone here. Your responses will be kept anonymous and they help us do better with our webinars. So if everyone could please answer to the following poll. Did you find participating in the webinar increased your knowledge and understanding of evidence-informed decision-making? Will you use the information for today's webinar in your own practice? And which of the following statements apply to you? So I will give everyone a chance to answer these questions. If you want to learn more about our webinars with NCCMT, you can visit us at nccmt.ca, Capacity Development for Webinars. So thank you once again for everyone for taking the time to come out to today's webinar. We learned a lot and I really appreciate our awardees taking the time to do their presentation. If you have any questions or concerns, please feel free to reach us at nccmt@mcmaster.ca, or you can visit our website. Thanks again, everyone.